the hospital considering conversion to a rural emergency hospital needs to submit an action plan. Now, that's not just a little application. This is like a business plan and strategic plan combined. What services are you going to provide? Which ones will you be retaining? Which ones will you be adding, modifying? Which ones will you exit, discontinue? And then, what services will you provide on an outpatient basis? And what are you going to do about your emergency department? And then, that's to earn the 5% supplement payment to the outpatient schedule. Then this additional facility payment that I talked about, which could be major dollars. You talk about how you're going to use that. Telehealth, operations, maintenance. You have a lot of leeway there, but it should be in that action plan. So the next question is, when does this go live? Well, the go live date, believe it or not, is not until January of 2023. So all of next year, we'll be writing regulations, and hospitals will be figuring out how they can do their action plans and how they can get themselves ready to make a decision. You know, the board has a fiduciary decision to make. Are we going to take advantage of this program? Are we willing to change our fundamental nature? We're still a hospital, but we'll be a different kind of hospital. We'll still be in business, and it's less likely that we'll close. Those are fiduciary decisions. So, you know, in essence, it is horrible to hear about all these hospitals that are in danger of closing. Every morning when I talk to somebody on my staff or I go through the little things I get in email, I hear another rural hospital closed or another rural hospital announced it was closing. We're all concerned about that because when it comes down to it, a rural hospital is an essential part of its community's social fabric. It's not just a healthcare joint. It's part of the fabric of the community. Our rural clients are always struggling against the trends. If there's a trend, it's probably not good for rural. And the last trend that was good for us was the critical access hospital programs that started several years ago. But I think here we have some legislation, a new legislation that by 2023 will be offering a path to preserve needed services in these communities and to keep that social fabric together, to keep that medical ecosystem intact. That's why it's a good piece of legislation. So let's keep working on it.